future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Teda as he shares insights into the healthcare of tomorrow and how we can help create it today.
Welcome to another episode of Smarter Healthcare with AI. Today's guest is Dr. Bruce Alan Kehr, founder and CEO of Potomac Psychiatry and HoloMD. He's a leader in innovative mental health solutions powered by AI, a best-selling author, and recognized top doctor. Dr. Kehr specializes in root cause psychiatry, leveraging advanced genetic and microbiome testing to provide tailored care for his patients. Dr. Kehr, welcome to the podcast. It is an honor to be sharing this time with you. And thank you so much for taking the kind invitation to be on the podcast. And welcome.
Thank you, Dr. Teda. Thank you for having me.
Oh, yeah. It's an honor. So I have to begin by asking you, what is root cause psychiatry? You know, so I forgive the chuckle. Of course, I'm a thoracic surgeon, so you know this is for our medical audience. This is a great conversation to have a thoracic surgeon speaking with a top psychiatrist, and so I want to ask you, what does the term root cause psychiatry mean? Because I think that'll frame a lot of our discussion.
And there's definitely an application for artificial intelligence in root cause psychiatry. Historically, the field of psychiatry has largely been focused on symptoms and functionality. And the DSM-5 is largely based in a heuristic framework of symptoms and behaviors and functions. And yet, inside our bodies, we've got 30 trillion human cells. In the brain, we've got 100 billion neurons and 100 billion glial cells. In our gut, we have 39 trillion microbes. And all of those cells are continuously cross-talking with one another. If we just take one example, immune system cells have on their receptors, have on the surface of their cells receptors for neurotransmitters. Likewise, neurons in the brain have on the surface of their cells receptors for cytokines secreted by immune system cells. Continuous crosstalk in the gut-brain axis and the brain-gut axis. And so when we look at our patients from a DSM-5 framework, what we find is nobody ever neatly fits the buckets created by DSM-5. Every patient has a heterogeneous set of symptoms. And so in root cause psychiatry, we go a lot deeper. We look at their personal genomics. We look at their gut microbiome. We look at their cells, their mitochondrial function, levels of inflammation, levels of oxidative stress. We look at the immune system and how that's functioning. We look at the role of infectious diseases in triggering a number of chronic mental health conditions. And we put together a database for each patient, what we call an N of one approach that we borrow from the oncology world, so that we can address each of the root cause drivers of the patient's condition. And we look a lot at their genomics as well as their epigenome. And we try to take a genetic and a biomarker-based approach then to treatment.
So for those of us in the lay world, you dropped a lot.
Oh, sorry.
You dropped a lot of dense information there. So let me ask this question. In my sort of work in this art of human care space, which has sort of informed a lot of my practice, I talk about the mind, body, spirit connection, which you have now elegantly and very scientifically woven in to this concept of, root cause psychiatry. So in other words, is it fair to say that psychiatry and root cause psychiatry and those things that impact, influence, and potentially give rise to behavioral health issues is interrelated and dependent and codependent on a number of issues besides just what may be going on in a person's world. In other words, it's the genomes, it's the microbiome, it's the gut, it's the environment, it's almost everything that you just outlined.
Right. Now, there is a complex ecosystem within which mental health exists. And so what I just outlined is a part of that ecosystem, right? We might call that the biological aspect of the ecosystem. But Hassan, you're absolutely right. Spiritual issues are significant in relation to mental health, interpersonal relationships, how things are going at work, how things are going with one's love relationships, what's going on socioculturally and politically. Great example of that is COVID, right? So that all weaves together to create an influence on mental health, either to create better or worse mental health.
Yeah. So, there's a reason why you're a top doctor, I have to say. And having had conversations with you and understanding how you approach the practice of psychiatry and everything that you've just said so far, it really strikes me that your approach to psychiatry, behavioral health, and how you care for your patients, no pun intended, with your last name being Dr. Kehr, it's holistic and it's comprehensive. And there's a myriad of components and parts that make up that sort of holistic evaluation of an individual. And
it is holistic and it takes a village. I'm sorry to interrupt.
Yeah, please.
But it really, we collaborate a lot. We collaborate with neuroimmunologists. We collaborate with infectious disease doctors, endocrinologists, internists, family doctors, nutritionists. There's a lot of collaboration that goes on because it is a complex ecosystem.
And it strikes me that your approach is a bit unique in that I don't know if everyone is taking this kind of approach. Is that fair to say?
Thank you for that. It's flattering. We didn't invent the approach. We depend a lot upon the work of others, many others. But I think, if I may segue to artificial intelligence and a phenomenal role for artificial intelligence in all this, we do have this exploding knowledge base in all of the fields of scientific endeavor that we've been just describing. And it's impossible for any single human, at least I can't, keep track and stay up on all of that science. However, we have built our first AI agent to help us with that, with our decision support in our root cause psychiatry program to help. It's already been trained on, they've already been trained on hundreds of thousands of PubMed Central articles in journals that we've curated, selected. So it is an approach that I'm really passionate about extending to other clinicians, psychiatrists, primary care doctors, internists, family medicine doctors, pediatricians, because they're really the front line of mental health care in the United States. And I think there's a significant role for AI to be able to help there with this kind of approach.
Huge opportunity. So that is a great way for me to ask this question. So what inspired you to start HoloMD? And tell us, those listening here, what is HoloMD, first of all? And then how do you see it transforming mental health care, particularly in the context of what you just described in this explosion of information and all of those factors that impact one's behavioral health?
The inspiration actually comes from childhood. We lost my brother when I was a child. My mother developed a severe mental illness, and she became a drug addict and had a lot of other mental health problems. which affected me and my brother. And to this day, other family members suffer from serious mental illness. And over the years, I saw the kind of treatment they received, and it was from bright, well-meaning doctors. But what was missing was this holistic approach. And at the time, in those days, the science wasn't there. The science is there now. And so to be able to bring this kind of approach to everyone is something that I care deeply about. We had the good fortune to be able to afford psychiatric care for people I love. And I don't mind saying I've had 17 years of psychoanalysis, which obviously is quite expensive. But for those out there who either are afraid or ashamed to seek help, who maybe don't have the money to seek help, that's all part of what drives me in HoloMD, what drove me to create HoloMD. So HoloMD is a mental health AI company where we have created Dr. Holo, who is our mental health superhero. And what makes him a mental health superhero is he has already been trained on 1,000 lifetimes worth of scientific literature. We take any psychiatrist 1,000 lifetimes to read what we've already trained Dr. Holo on. And we train him on empathy and compassion and a bedside manner. And we see a variety of applications for our Dr. Holo. One is decision support. Our doctors at Potomac Psychiatry are already using Dr. Holo for decision support with complex patients. And then what we're really incredibly excited about is using Dr. Holo for remote therapeutic monitoring. So in the United States, we have 150 million Americans who live in underserved areas to get mental health care. And many of those Americans want to seek mental health care. Wait lists are very long. 3 months or more to get in to see a mental health care professional. And then once the patient is seen with their initial evaluation, another 3 months or more to be seen again. And so for the patients, they're scared, they're overwhelmed, they may be feeling hopeless, they may be feeling desperate. They really don't know where to turn, and finally they get help. And then they have to wait a very long time, possibly been prescribed medications. Maybe those medications cause side effects. And so we are now creating, we call him Dr. Holo RTM, remote therapeutic monitoring. So between those clinic visits, every day Dr. Holo, acting on behalf of the patient's treating physician, will check in with the patient and have a very nuanced conversation with that patient based upon their history, their mental status, what's been prescribed for them, and then all the training we've done for Dr. Holo. So we can think of Dr. Holo for the treating psychiatrist or primary care doctor as kind of that curbside consultant, right? As a physician extender, right? Curbside consultant to give the treating doc a second opinion, right? And then a real, if you will, holistic representation of that doctor day to day, just checking in with the patient. And then if the patient's fine, no need to worry the treating doctor. But if the AI agent finds evidence of decline, clinical worsening, side effects that aren't getting better, adverse events, and other events of concern, that will alert, automatically our AI agent will alert someone in the doctor's office to be involved and potentially involve the doctor to intervene.
Yeah. And you talked about the scope and the complexity of this issue and problem. Oh, over 100 million, you said, 150 million people without access to behavioral health care. That's almost over a third of the population in the United States. And obviously, if you extend that globally, it's even probably more impactful. With you having a platform like HoloMD with its capability, how do you see it making an impact on that population? In other words, yes, it's a physician extender, but there will still be a care team that will have to leverage this technology and this tool. How would it potentially impact that population?
Great question.
Yeah.
So a lot of it has to do with workflow analysis. Right? We have practitioners who are overburdened. We have more and more. The good news is more and more people are seeking help. This shame barrier is still there, but gradually there's less and less shame around seeking help. The challenge, though, is that 60% of psychiatrists are 55 years old or older. And so that group, that cohort is going to be retiring in the coming years. We don't have enough psychiatrists in training or who are younger to take their place. The good news there is we have psychiatric mental health nurse practitioners who are helping. We have non-medical therapists who are becoming more available. But this medical side is critically important. So if we can provide Dr. Holo to leverage his knowledge, his expertise, his help, to help those overburdened doctors do things better, smarter, faster, then we feel like we've really created something of value. And for proprietary reasons, I don't want to get into all of the ways we're going to address and improve their workflow. But we have being a practicing psychiatrist and working with colleagues at Potomac Psychiatry, we have a deep knowledge and understanding of what the daily workflow is like and the challenges my colleagues face. And so part of our technology roadmap is to process engineer Dr. Holo, not to get in the way of that workflow, but to accelerate and enhance that workflow so that Dr. Holo is really a huge advantage for the practicing doctors, not someone who's adding to the burden.
And so I can't help but just highlight a couple of things that you said and perhaps share a bit of personal experience myself. So being in the military many years, obviously behavioral health has always been a big issue within the healthcare space of the military. Personally, I've had engagements with behavioral health professionals, particularly after my deployment. That was a very difficult time for me. Tremendously helpful in sort of my return to normalcy in many ways and just helping me to cope with stress and so forth. When you think about what you just described, the overburdened workforce, the need and sort of the gap and the chasm between those that need services and those that can provide it, it strikes me that HoloMD is what we would like to call in the military a force multiplier. Is that fair to say?
That's a great way of describing Dr. Holo, a force multiplier.
In other words, multiplying the sort of capacity and the ability for those that are the professionals in this space, whether they be the nurse practitioners, as you talked about, the medical professionals, those that are non-medical, that are all working in this very important and critical service area of helping people with behavioral health challenges. This becomes a tool that they can leverage to sort of increase their capacity to see more people, but not only see more people more effectively and perhaps make even bigger differences in their lives.
That's extremely well stated, very elegantly stated. I would add that it also will create a new revenue stream for them. So beginning around 2018 or so, Medicare and then following suit, the major carriers and then Medicaid, many Medicaid plans, began recognizing the need to be able to monitor patients remotely between visits as a way to manage the burgeoning costs of emergency room visits and hospitalizations and greater morbidity and mortality. that derives from chronic diseases that are not well monitored or managed between clinic visits. And so they came up with E&M codes and then RPM, remote patient management codes, and then more recently RTM, remote therapeutic management codes, to be able to allow physicians to be paid for the monitoring of their patients between visits. The challenge, Hassan, has been that when doctors are busy and feeling burnt out and overwhelmed, if you add work to what's already an incredibly hectic day where many doctors are falling behind every hour in their schedule, it's a formula that's not going to work. And so now with AI, we have this remarkable opportunity to transform that E&M, RPM, RTM reimbursement model into a set of products that actually, to your earlier phrase, are force multipliers, as opposed to, I don't know what the correct term would be in the military, but what comes to mind is force depleters, or something like that, right? Because the solutions so far, many of the solutions by very well-meaning, smart people, have added to the workflow burden of the physicians. And so what we've done, we brought aboard our team people who have worked for some of these other companies, who really understand the entire workflow of the clinician from the beginning of the day to the end of the day. And so we're building into our roadmap a way to force multiply and alleviate workflow burden. But we couldn't do that without AI. It's just not possible.
Yeah. So a couple of things I'd like to build upon what you just said. There's this, as you said, there's sort of shame barrier that has existed for, decades, obviously. Now you hear people, very high profile people, talking about, yes, I have a psychoanalyst, I have a psychotherapist, I've been on medication even. Probably would never have heard anything like that. No one confessing that years ago. The stigma, as you mentioned, has been largely removed. And I think, if nothing else, COVID, may have been, good in the sense that it exposed that, yes, as individuals, we are subject to stresses that impact our lives and can not only be a burden to us, but can impact our very livelihood and our very well-being on a behavioral health standpoint. So now that the stigma has kind of been a little bit less, significant, and the challenge for seeking care is not as great in terms of the stigma, what has been your experience with the acceptability of people engaging with a platform that's not a human being? In other words, telemedicine, or in this case, a dynamic platform that's going to be maybe text-based and so forth. And someone realizing, hey, there's not a real human on the other side. Yes, someone is going to look at that information at some point and get back to me. But, what is, it's a bit of a leading question because I know a little bit of the answer, but what's been your experience with this?
It's a great question. And the reason I'm smiling is this summer, I went to Montana to fly fish, and the place where we were staying had a lovely barbecue, and we sat down at a table with a family, and there were two young ladies as part of this family. One was in middle school and one was in high school. And we got to talking about AI, and they each of these young ladies had an AI boyfriend, and they had a real boyfriend. And so they would say to their real boyfriends, my AI boyfriend is really not nicer or kinder to me than you are. You need to be nicer to me, right? So
Interesting.
It's fun to get a good laugh out of that. So clearly, young people are engaging. So if we go back even a few decades to when patient-reported outcomes started to be analyzed, and things like the Palm Pilot For example, early an early version of what's now a smartphone, right? When people were engaging with Palm Pilots in, let's say, clinical drug trials, and the Palm Pilots were capturing patient-reported outcomes information, some studies showed that patients were more honest with the machine. So I remember one study where when patients see their doctor, they're 30% truthful, but with the machine, they're 70% truthful because of that issue of wanting to please the doctor and not disappoint the doctor and feeling ashamed or embarrassed of, not doing what the doctor recommended. So that's some early data. What we're seeing, we deployed our first agent on the Potomac Psychiatry website, and every week we're seeing more and more and more conversations with our AI agent on the Potomac Psychiatry website. Every week brings more conversations. So it would appear, and again, very small number of data points, it would appear that the general acceptability is increasing. And certainly, I think this was, ChatGPT data, that it was the most rapidly adopted, widely adopted technology in the history.
Yes, that's right. 100 million subscribers in less than a month, and essentially a month. That's more than any other adoption for technology. You're absolutely right.
It's extraordinary. And I'll tell you again, very small data points here, but my colleagues and I are now using Dr. Holo's decision support capabilities live in real time with patients via screen share.
Wow.
In the session with the patient. I can tell you, the patients really like it. They really like it because they feel that there's that extra dimension to their care.
Sure.
And let's face it, all of us docs, we work hard, we read the journals, but we can't possibly know everything. And we can't possibly, in our field, stay up to date on immunology and genetics and gut microbiome science and the other nutrition, the other fields that influence mental health, right? So you don't have access to this tool real-time live in the session with the patient and screen share it is something that the patients seem to really like. So again, this is all small data points, small numbers of people, but it would appear that it's generally well accepted. And then I think that the UI UX is obviously critical, right? So for the patient, how compassionate is the agent? How friendly and warm is the agent? How empathetic is the agent? Can we build in a lot of human qualities? The agent, all that will influence the experience.
All right, that interface and that experience that they're having with the platform, absolutely.
And the expertise. I'm sorry. One last thought. Right, it's not enough to be warm and caring and empathetic. That all helps, right? But the expertise is critically important, and the relevance of that expertise. But as we like to say, we try to meet each of our patients where they are, right? Not according to our agenda, but where they are, what they need. So to try to build in that, what we call a bedside manner, or medical wisdom.
I can't help but say, it's so profound, but also very very interesting that what you're describing is in essence the very definition of smarter healthcare, right? And we are using AI because you're able to, as you said, help that practitioner be more smart about what it is that they need to know to help that patient. As you mentioned, in the time that we've been here just talking, there have been, I don't know how many publications, right, that have been released that are out there in the journals right now, in the zeitgeist, that we have no idea about, right? We can do our best to try and read them, but that could be a double full-time job just to keep up on just the articles, let alone practice and then integrate and incorporate it into your daily routine and your workflow. And I can't help but wonder, as a physician, as a cardiac surgeon myself, how important those moments, and more importantly, the periods of time between your patient encounters, right? When we see a patient for surgery, we operate on them and then we discharge them and they may come back for follow-up. But then there's that interval in between, right? Where things can go really, really great. And then we see them again and they look great and we never see them again, the surgeons. But then there's also those times where something happens in the interval between when you saw them and the last time you saw them, they were doing great. The wound was looking good. The heart was functioning fine. Our tests and studies were all positive. But then something happens when they're at home and we don't have visibility on that until we see them back in the ER or we get a call from their primary care doctor or someone else. So in your discipline, which is really dynamic, where, you have all of these variables, environmental, biological, stress, just anything that can happen in a given day, especially for someone that may be, experiencing a lot of challenges, something can trigger that individual and set them off in a place where, they're now having a problem. And you may not have that visit again for another 4 months, maybe 5 weeks, maybe a few days. This platform that you're describing, where you're having this daily contact with someone, just speak a little bit about that and what's been your experience and also what studies have shown about giving, this opportunity to sort of have a daily contact with an individual that gives insight for the care team to sort of be aware of and hopefully act upon if there was a trigger or something that was impacting the patient in a negative way.
Sure. Well, the reason I'm smiling is I think about a conversation I had with my wife some years ago about, what might a wife really like from her husband? And she said, well, to be more like a close girlfriend, right? So if you think about a close girlfriend, caring, empathetic, supportive, listening, treating with kindness. And let's move from that to something. My wife's dad was a psychoanalyst for many, many years. And when I was starting out in my career, he gave me a piece of advice I think about a lot. Never underestimate the power of listening, because you may be the first person in your patient's entire life who ever genuinely listens. Yeah. Well, I think about that, and I think about Dr. Holo as being a really good friend and a really good listener to start with, right? Because look, life is hard, life is painful. It's harder on some folks than others. Life is hard on everyone. And so if you can have a daily contact with a friend who listens, who's caring and empathetic, who can also give advice, who can also help you understand the elements of your treatment plan, why your doctor prescribed different medications or different self-help techniques, that can help. So just from a heart standpoint, having that kind of daily contact is a way to feel, we call it, the psychoanalysts would call it, emotionally held. It's a way of emotionally holding someone through some rough patches. And if we look at some of the data, so for example, there's another company kind of called PainScript that works in the chronic pain management, substance use disorder, opioid use disorder space. And it uses a rotating set of questions, different set of 3 questions each day to reach out to patients who have chronic pain to see how they're doing. They did some studies there. Lynn Webster, who's the chief medical officer, did some studies there showing that through that kind of daily contact, there were statistically significant improvements in depression, fatigue, anxiety, and then I don't think it met statistical significance, but certainly trended toward reducing cravings and statistically significant reduction in pain, levels of pain. So, and there are other studies out there that support. For example, let's take your field. There are platforms that look at daily weights, right? Pulse ox, right? Some of those other cardiovascular measures where the patients find that helpful and supportive. And then, your colleagues can intervene if, let's say, there's this sudden increase in weight, putting more load on the heart, right? I don't know, prescribe some Lasix. Right? I mean, you probably are way closer to all that than me with those kinds of platforms.
Yeah. No, absolutely, you're right. And that's why I couldn't help but think, that correlation of like having that ability to monitor a patient's cardiovascular health in between the visits has helped. And we've had many good studies that show demonstrably good and better results and outcomes ultimately for patients, because we're able to intercede and to intervene rather when there's something that may look like there's the beginning of a problem. Like you said, adjust the medication so that a patient in heart failure doesn't go into the point where they're in now stress and distress that causes them to be readmitted to the hospital. So you're absolutely correct. I think this ability to be able to keep an eye and, in this case, listen to patients in between the visits, I think it seems very compelling. How do you believe that patients with this sort of platform and their daily interaction with it become better partners in their health with the care providing team? Because it seems to me like now there's a little bit more participation, right? There's an engagement every day. And how have you, not only personally, but professionally as well, and from your colleagues, noticed, or I have noticed, the difference in terms of the participation and the patient being sort of more of a partner in their care and the outcomes that you see?
That's a great question. I think at the root of every physician is a wish to be a hero to the patient and the family, and to really heal and cure and help that patient. And that's a motivator for many, many, many physicians. And yet, if we look at the challenges of daily practice, 6 visits an hour, some cases 8 visits an hour, keeping up with the charting, the after hours phone calls, the crises, the emergencies. It's no wonder that, approximately 2/3 of physicians feel burnout, right? And yet at the same time, they really want to feel like a hero to their patients and want to see better outcomes with their patients. And so one way to help bridge that gap is through daily contact with the patient with an AI agent like Dr. Holo, whereby calling a force multiplier, that patient feels held between the visits, feels engaged between the visits, feels connected with their doctor between the visits. This is not to take the place of the doctor. This is a little bit of that doctor coming into the patient's life every day. So let's take a use case that we think about a lot. We have this example in our pitch deck. Woman, Helen, she's in her 50s. She's had several different tries with treatment with psychiatrists. She falls into the realm what we call treatment resistant. So she's partially responded to medication, and she's on a couple of different medicines. She sees her psychiatrist. She's prescribed another medication. One is being dose escalated, and one is being gradually weaned. She's put on this regimen, and her doctor can't see her again for a month. Not an uncommon story. So the first few days after the visit, she's having some problems, right? So she starts talking to Dr. Holo about the problems. Well, first of all, she's upset because she can't be seen again for another month, but she doesn't want to call up her doctor to complain about it, right? Because it's a new doctor. She doesn't want to antagonize the doctor. She's scared. Am I going to get better? I've seen these other doctors. I like this doctor, or I don't want to overburden him. So she starts talking with Dr. Holo, and she's unburdening herself. I'm really upset. I'm angry. I really want to be seen soon. And then Dr. Holo starts to help calm her and give her support and helps her start to think through what she needs to call her doctor about versus what is a transient side effect that typically in most patients resolves in a few days to a week because he's been trained on just that. Just a few days later, she's feeling better. She's not having the same side effects. The new medicine is starting to help a bit. But now she has an issue with her child, right? Dr. Holo checks in. Hi, Helen. How's it going today? She says, well, actually, I'm having some issues with my child. Goes in again, unburdens herself. Dr. Holo gives some support and says, well, look, here's some things you might talk with your child about. Right. So Dr. Holo is trained enough and is aware enough of Helen and also remembers the prior conversations to be able to have this level of conversation so that when she goes back in to see her doctor a month later, a summary of all that is presented to the doctor. And so that all hasn't been lost. And that's the force multiplier, right? It makes Helen a better partner. She's not then angry at the doctor. She's not going to abandon the practice. So the practice, it costs a fair amount of money to attract the patient into a practice, right? You want to retain the patient. So here's where that force multiplication can come in, as well as engaging the patient as a partner in the treatment.
Yeah. I mean, this all sounds wonderful. So for those that are out listening to this and thinking, wow, it would be great if my doctor incorporated some of these tools, and for the practitioners, they're thinking, well, how do I get this started? How do I bring this into my practice? How do I leverage this platform? It all sounds great. It sounds wonderful. And I'm certainly biased, of course, but what do you say are some of the challenges that you've had actually integrating this technology into the workflow with your practice, introducing it to the patients so they feel comfortable using, an AI agent, the technology? What have been some of those challenges and how have you overcome them?
Well, we started out in a different direction. So our initial direction was to use AI to create a sales and marketing agent. And so we've done that. We built a sales and marketing agent. It increases conversion rates of inquiries to book patients by 50%. It's increased engagement time on our website from 53 seconds to 3 minutes and 14 seconds. Our referral sources are using Dr. Holo to better understand when they want to refer a client, what our docs do, what kind of services we provide, or have the client go on, use the agent. And that was going to be our initial offering to the marketplace. Then we started to look at it and we realized that as a young company, that would require an upfront investment by the customer, right? Because it has to be an EMR integration. There has to be training on the customer's CMS, CRM system, right? Everything in their website platform. And so that seemed like, as a young company trying to establish its reputation, as a set of hurdles. So then we took a deep breath and a step back and thought about, well, how can we leverage all of that training of Dr. Holo into something that could be more widely adopted and better, because we're a business, right? We're beginning to attract investors, so we have to be able to show them, how does the company make money? Right? We're out to do good things in the world, but we still have to make money. So we, as I said, we brought aboard people who are really experts in RTM, And that appeared to be the way to go. So what we did was, as an intermediate step, we began to deploy the decision support tool in among our doctors as a beta. I was telling you earlier about how we're using it, how the patients really like it. And now what we've done is we have a demo of the RTM, Dr. Holo. We have small numbers of people now being brought onto the demo. In about 2 or 3 weeks, we'll be able to bring a lot more people into the demo. And then by the end of the year, we'll have the MVP, minimum viable product, on, or building out the elements of the larger platform we created to cover the RTM. And so what we're doing is we're using a combination of lean and agile methods to be able to work to get this right. So we're already getting feedback from our docs about what they like, what they don't like, and then we plan to more formalize, as we just hired a VP of sales a week ago, who's active in the RTM space. So we're planning to formalize the data capture from customers and patients about all of that, so that what we think we know about force multiplication and workflow improvement is not just an idea in our heads, right? We're going to ask how we do it. And we will, just like we course corrected around our direction for HoloMD, we'll course correct in our weekly sprints, product sprints.
Yeah. Now, you have had the great experience of having started other companies and have always been an innovator and sort of on the cutting edge of your discipline. When you think about people that are now looking at AI and sort of this powerful technology right now in 2024 and thinking to themselves, oh, I'm a little hesitant about incorporating it into my practice. I've got a great practice. I've got a good panel of patients. Many of my patients have stayed with me. They don't seem to be leaving, so I think I'm doing okay. Or even those that are maybe not, right where they want to be with their practice and their panel of patients, and they're hesitant. What would you give in terms of advice, encouragement, or just perspective in saying, this is a technology that you should embrace, or what are your thoughts about that?
Sure. That's a great question. And I try to approach this from a place of humility. If we go back to those 30 trillion human cells, 200 billion cells in the brain, 39 trillion microbes in the gut, that complex biological system, I approach that with great humility because it's a miracle, right? It's miraculous. Life is extraordinary, and life is precious, and life is miraculous. And so if we think about ultimately what's in the best interest of our patients, and I feel I can say this as a psychiatrist, we do a really good job for about half our patients. Roughly a third to a half are treatment resistant. They suffer for years. Their families suffer for years. I saw this growing up. I've seen this in my own family in recent years, in the extended family. And this treatment resistance is something that AI can help us solve. So we don't have to figure it all out ourselves, but if we approach AI as a curbside consultant, Dr. Holo is your curbside consultant or your second opinion colleague, right? All of us, I would hope, from time to time, have gotten second opinions for our patients, right? We feel stuck. We either get a curbside consult from a colleague or we'll get a formal second opinion from a colleague. So if we think of AI as that curbside consultant, that second opinion specialist, it's not threatening, it's not scary, it's just another way to get in the field of law. There's a company that created what's called co-counsel. Co-chair, like, right, who's next to you in court, right? Who's your co-counselor? right? So it's the same idea here for us docs, right? Who can be there at your side to just help you do a better job for your patients.
Yeah. Something you said, I can't help but ask this question. You said that, in your practice, and imagine this may be true and extrapolated to other practitioners, that there are people that are just treatment resistant, right? Those that you just really can't help. But what about patients that are in underserved and sort of socioeconomically, historically just never having access to behavioral health services? Do you see this platform and AI as a way of reaching those individuals that are otherwise underserved or not served at all right now?
Well, this is our biggest dream of all. And obviously, we've got challenges ahead that we will surmount to get there. And our largest dream is that ultimately, for those who can't get in to see a psychiatrist or can't afford a psychiatrist, to have Dr. Holo be there for them to help with treatment. So, for example, let's say, one of our dreams is to be able to provide something for the homeless, right? Who suffer terribly from mental illness and from loneliness, right? Now, to be able to provide Dr. Holo to homeless people, we would have to get FDA approval. And so we're beginning, as part of our strategy and our tactical plan, we're beginning to lay the groundwork for getting that FDA approval as a medical device down the road. And the same thing for the underserved who, let's say, can't even afford a copayment, right? Could we potentially become a mental health benefit that society offers or a municipality offers as part of a welfare benefit, social benefit? These are the sorts of things we're very passionate about. Obviously, we have to get from here to there, right? And so with RTM, Dr. Holo, we have a learned intermediary between the platform and the patient, right? We'll provide the first level learned intermediary at HoloMD, and then the second level learned intermediary is the doctor who gets escalated the mission critical alerts. But that's the ultimate dream, Hassan.
Yeah. So, someone listening to this might say to yourself, well, the obvious question, of course, would be, would you be worried or would you be scared? Would you be concerned that HoloMD may replace Dr. Kehr and his colleagues?
No, I'm not scared of that at all. I think there is a lot of fear out there about AI taking the place of doctors. The way I see AI is an extraordinary tool to make us better doctors. That's all. Patients will still want to sit with a human being. They're going to still want to relate to a human being. There's no substitute for experience in medicine and in lots of aspects. There's no substitute for having lived life, right? How is an AI agent going to live life, right? I guess, a robot going around, the world, okay, maybe, but it's not going to give birth to a child. It's not going to raise a child. It's not going to experience the death of a parent.
All of those things
that you,
right? All those things that you bring to bear in your practice and your approach of care for others. Absolutely. It was sort of a bit of a rhetorical question because, of course, I get that asked all the time. As a surgeon, surgeons are like, oh, no, robots can't do what we do. But, potentially one day they may be able to do some of these things. But I tell my colleagues when asked that question about AI replacing us that, no, it's a tool. But I think, the doctors that should be more worried are the doctors that are not using AI in their practice, being replaced by those doctors that are using AI in their practice, because It is going to be the force multiplier. It's going to make them better. It's going to make you be able to take care of those treatment-resistant patients that, right now you just don't have the tools to be able to take care of. And I think that's the way we should look at it holistically as a profession. So in the minutes that we have remaining, and we don't have too many more minutes left, just in a few minutes we have remaining, and you started to touch on this, what would be your dream, your vision, and in your hope for what the next 5 years will bring for you, for your practice, for your profession, using AI, for, taking care of those that need help and in greater society?
Well, that's a great question. For me, HoloMD and Dr. Holo meets a deep emotional need, going back to my mother and others in the family who've struggled with mental illness, and to be able to make Dr. Holo available to millions of people ultimately. And I've got a great team that's sharing this journey with me. So that's really important. 5 years from now, I'd like to see Dr. Holo as a mental health benefit in large corporations. And then I'd like to see us have a foundation by that point that's well underway and funded to help the homeless, and is developing a Dr. Holo that could be FDA approved for the homeless. And that would be an important aspect of the legacy I'd like to leave behind.
Wow. Well said. Well, from what I know, Dr. Kehr, and from your great team and the work that you've done, and being able to be a part of that journey to some extent, I can't help but wonder that you definitely have all the tools in place to make your vision a reality. And I'm so looking forward to how that all unfolds over the next few years. And a special thank you for sharing your time with us and sharing your wisdom and insight and bringing this fascinating, wonderful, and great innovation to the world. So thank you so much for being a guest on Smarter Healthcare with AI.
Well, thank you for all that, and thank you for your extraordinary efforts in AI as a doctor. You are a true pioneer. You've had a remarkable track record of success in so many areas of medicine and elsewhere. And you are a great humanist, an author, and a poet. And I want you to know I'm a fan and a deep admirer and someone who respects everything you're doing.
Oh, well, thank you. You're very kind.
I'm honored that you included me today.
You're very kind to say that. Well, thank you so much. And for those of us that are listening, please watch and follow closely the work of Dr. Kehr and HoloMD, and there'll be great things to come, I'm sure. So thank you all again for this wonderful episode, and thanks for listening.
Okay, thanks again.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Teda.com. Smarter Healthcare with AI with Dr. Hassan Teda is a production of Forbes Books.